I will just start by putting up my slides.
Thank you.
So good morning, everyone, and it is a real honor to be able to join you, at least virtually, at this meeting. And I'd like to begin by appreciating the Pontifical Academy of Social Sciences in UMass for hosting such a significant workshop over the next 2 days. And as noted, my colleague, Professor David Bloom, is currently on travel. So I will be presenting on our joint behalf, and I'll be providing an overview of how this pandemic has impacted the youngest citizens. And in this talk, I'll begin by presenting briefly an overview of why early childhood matters in the life course, and the different ways in which the pandemic has impacted both young children, but also the significant caregivers in their lives, those caregivers in families, as well as caregivers such as childcare workers and educators. And then I'll highlight some important considerations that I think are critical if we are to accelerate change in our progress, in our research programs and policies that impact outcomes for young children and their caregivers. So why does early childhood matter? It's important to point out that before the pandemic, an estimated 250 million children, that is 43% of under fives living in low and middle income countries, were unable to meet their developmental potential in the first 5 years of life. So we were already failing high numbers of young children around the world, with higher burdens in Southern Africa and South Asia. In the first 11 months of the pandemic alone, disruptions to ECCE, or early childhood care and education services, has increased this number by a further 10.75 million. And this, of course, has long-term implications to children's developmental trajectories along the life course, and further compounds the inequities that have been discussed thus far this morning. So early childhood development really refers to the period from conception to 8 years of age. And we see children at this point transitioning from their family and home environments to being more and more exposed to neighborhoods, communities, and early childcare and early education environments. Thus, our intervention and our thinking in the pandemic recovery has to be centered in all of these spaces. And of course, we recognize that this composite of development encompassing motor, language, cognitive, and social developments, here the skills acquired in those early years predict the later life learning, productivity, outcomes in the life course as adults, and of course, our capacity to have good physical, mental health as well. And this is particularly important because the brain is developing at its most rapidly in those first 3 years of life. And while development is a fairly robust process, we can think of it as our genetics forming the blueprint or the roadmap, but it's really the child's experiences, their exposure to the environment, that shapes the quality of healthy brain development. Due to greater neuroplasticity at this time, there's a sensitive window of opportunity. Therefore, it's critical for us to promote protective environments and reduce the risks that emerge from the harmful environments around the child or harmful experiences around the child. And of course, the development that's established in these early years is the foundation upon which later development and later interventions and other important points in the life course, such as adolescence, are built upon. And we also know that intervening early can reduce the disparities, the gaps that we see between advantaged and disadvantaged children. We also know that the risks that we see for early childhood development are wide-ranging. They encompass economic risks, biological risks, and psychosocial risks. and those which we have tended to negate include things like maternal depression, family distress, violence, and child maltreatment. These risks, of course, don't occur in isolation, so our intervention thinking cannot happen in isolation. It requires multi-sectoral coordination and actions to address holistically the needs of young children. So what are the different ways that the pandemic has impacted young children and their caregivers? We know the pandemic has impacted every aspect of nurturing care, be it children's health, their access to food security and healthy nutrition, the capacity of caregivers to provide optimal, positive, nurturing and responsive care, children's safety, their security, as well as their opportunities to learn. It was Professor Donald Winnicott that was quoted as saying, "There is no such thing as an infant." And of course, he is referring here to the fact that when we think of a young child, we cannot think of them in isolation, but the well-being, the mental health, the access to resources and the competencies of their caregivers matters in terms of how we can provide optimal well-being for the family as a whole. As noted this morning, in this first period of the pandemic, we have seen over 5 million deaths of caregivers, be it parents or significant grandparents responsible for the care of young children. In 3/4 of these, we have seen that the loss has been the loss of a paternal caregiver. There are, of course, risks along the life course now for these vulnerable children in terms of their health, their psychosocial well-being, and their economic security. And it's an imperative that we think about multi-sectoral actions that target the most vulnerable within these populations to ensure the risk to institutional care is mitigated. It is preferable in many cases to have family-centered care, kinship care, high-quality foster care as options. Prior to the pandemic, we knew what worked for young children. We knew, for example, early parenting programs or home visiting programs recommended by the UN were essential for young children's healthy development. A number of systematic reviews and meta-analyses implemented in looking at studies in high, middle, and low-income countries have shown that such programs consistently benefit children's cognitive, language, motor, social, emotional, and behavioral outcomes, as well as the quality of attachment between children and their caregivers. However, during the pandemic, a rapid review has shown that there have been significant disruptions to care and protection. While this review noted that there was a reduction in the reporting of child abuse, it can be speculated that this is likely due to a reduction in the safety nets that children have access to. Safety nets such as child protection programs, social protection programs, and of course, early childhood care and education centers, which are often the places where risk can be flagged. While gender inequalities persist in society, and particularly with regards to the burden of care, there is indication from both qualitative and quantitative studies that during the pandemic, paternal involvement in terms of caregiving for young children has increased. How we leverage this during the recovery period and beyond is critical in terms of having more equitable outcomes for care in society. Prior to the pandemic, we already recognized that maternal depression was significant and widespread. For example, in low and middle income countries, depression during pregnancy and postpartum was at 15 and 20%. This is significantly higher than those prevalence figures that we've seen in high-income countries. This is not only negative and detrimental for women themselves, but also has impacts in terms of the young children's cognitive development, the quality of their attachment, for boys, behavioral development outcomes, for infections. And these impacts aren't only in the short term, but given the chronicity, the severity of a particular type of maternal depression, it is likely to also have reverberations along the life course. Every survey seemed to point to the fact that paternal distress had increased during the pandemic in terms of reports of depression, stress, and parenting-specific stress, and this was globally reported. It also impacted the mental health of our very youngest children. And in a survey of just over 60,000 caregivers in Colombia, Costa Rica, El Salvador, and Peru, 61% of children reported at least one symptom of mental distress. This is the youngest children. It's important to recognize that while the pandemic has caused disruption, we were already failing these children prior to the pandemic. This is just one example of data. In terms of access, and this is access only, not referring to quality of programs, early childhood care and education services had poor outreach to young children. In the lowest income countries, this was as low as 20%, up to 79% in high income countries. This was also with inequities between urban and rural populations and with more remote regions around the world. Across the pandemic, around 50% of in-person teaching days were lost. And for the youngest children, online learning is not always the most appropriate method to compensate for loss of in-person learning. And this, of course, had consequences for moving children off track in their development in those crucial early years, from 2 to 6 million in the low and low middle income settings. There were disruptions to childcare, and again, we see this inequitable outcome. For example, in the US at the beginning of the pandemic, 40% of childcare center operators reported at risk of being closed permanently. In rapid surveys, the households in the lowest income groups were more likely to report that their children would be unable to return to their prior childcare once things reopened. And this, of course, has impacts for the safety and security of young children. It also has impacts for the capacity of their caregivers to participate in the labor force. So how have we responded to this challenge? It has been clear that NGOs, civil societies, governments around the world have responded to modify programs, to innovate, to ensure that parents, caregivers, and educators are able to reach young children around the world through adaptations of existing home visiting, parenting, and early childhood care and education services. However, there are two key questions that we need to consider. Are these interventions meeting the needs of caregivers, or are they adding to the burden of already highly distressed families during this time? Secondly, are these interventions compounding existing inequalities in society? For example, internet access or technology solutions were a big part of those modifications. Yet a survey by the Interdevelopment Bank shows that in the Latin American and Caribbean region, only about 45% of households have adequate access to internet, and smartphone penetration is as low as 32%. Therefore, in the recovery, we need to consider blended approaches that do not exacerbate the existing inequities in society. And while there has certainly been visibility of early childhood development, care, and education goals in the Sustainable Development Goals, for example, we also know that the progress has been slow over the last decade. For example, there has been an increase in the number of countries with national policies embracing early childhood development, but implementation of scalable programs is few and far between, with significant gaps in our understanding of the quality of those at-scale programs. Examples include Grade R in South Africa, the Chile Crece Contigo program, and Criança Feliz in Brazil, as well as the Integrated Child Development Services in India. But these are a handful of programs. For the majority of cases, early childhood development interventions tend to be short-term, project-based, with very little outreach and reaching few numbers of children in terms of the scale of the challenge that existed pre the pandemic and that it has been exacerbated during the pandemic. The cost of inaction, of failing to address young child growth, can impact on about 176 billion in lifetime earnings. The failure to implement basic parenting and preschool programs is estimated to cost countries anywhere between 2 and 4% of their total GDP. And failure to address COVID-related preschool closures may result in just over 800 billion in lifetime learning losses, because of course, these aren't just immediate losses in terms of preschool outcomes, but have reverberations in primary and secondary education as well. So early childhood is the foundation for lifelong outcomes. We know that these were interventions that were underinvested in prior to the pandemic, and our solutions have to be multi-sectoral. We also know that while we can learn from other crises, such as HIV, about what works, we also need to recognize that a lot was not working because of underinvestment prior to the pandemic. And is there a silver lining where we can use this opportunity to strengthen the fragile systems that were serving young children by investing in the early childhood workforce, which the pandemic has shone a light on in terms of how undervalued and poorly paid and poorly trained this workforce was, monitoring financing for ECD and tracking progress. We also need to recognize that our solutions must have equity front and center. I close with the comment, a quote by Marian Wright Edelman, founder of the Children's Defense Fund in the US, that if we do not stand up for our children, then we do not stand up for much. Thank you.